This
Today.
conference will now be recorded.
Our training today is going to be part one of our physical exam content. We are going to speak to the providers and provider workflow. Those of you who are not providers, your support clinic staff or billers or surgery schedulers who want to know how this process looks, you are more than welcome to join us today, but we will be speaking to the providers in terms of how to build their physical exam templates. We're going to go very high level today, and then we'll dig down a little bit deeper into how to build the template piece of things tomorrow. We will see how far we get in our process tomorrow, and if necessary, we can extend our physical exam training until Friday. So we'll see where that goes, and I'll communicate that with everybody to make sure that we're all on the same page, so that everyone knows when you should be available to participate in our trainings. So let's get started. All right, so like always, we are going to launch our cloud login screen. For those providers who are joining us for the first time, this is our screen that we're going to log into the Allscripts cloud. This is like logging into the computer. This will be that complex password that you can get from your practice manager if you haven't received it already. Once we log into the cloud, we're going to double click on our mountain folder, and then we're going to launch our clinical module. And here we're connecting to the application. As we're doing so, I want to make sure that everybody knows that we're going to talk about a couple of different options of how we can record in our physical exam modules today. And while we log into our application, our green screen, if you will, again, those of you who haven't been part of our previous trainings, the application does not exist in configuration. We can hit OK. That means that we don't have any of our live data in there yet. And so that's what it's pulling. And again, those of you who have not participated in our other trainings, I highly recommend that you go through our trainings, especially for our login and basic navigation, which was on day one. Then we have our user customizations that were sent out for day two. And then our next 3 days were focused on the patient intake process. And depending how your office works, you might or might not be interested in that process. But regardless of how you feel about the patient intake process, I do highly recommend that you go back and that you watch the logging in, basic navigation, and user customization on day 1 and 2 recordings so that you can make sure that your setup is appropriate and you know where to find things. So I'm going to pull our patient. Make sure that our search training patients box is checked and click search. And I'm going to launch our chart. As a reminder, our encounter selection screen is populating because we haven't signed off on our chart from last Friday. That's because we're adding to it. In normal circumstances, we would create a new encounter if this were a patient that we were seeing today. But because of our unique circumstances of us training, we want to make sure that we're adding on to the patient visit. So we're going to launch our Friday visit. So here we are in our patient's face sheet. As we talked about before, this is our patient intake that we've done on the left side, our medical history. We can see any of the medications that have been prescribed to the patient here in our middle column. In the top, this is where we are going to see patient documents. These are the folders for our charts. So we would find our past encounter chart notes. We would find any scanned documents that might come in, anything that comes in through the interfaces, such as our op reports or our imaging reports that are coming over. Those will be categorized in subfolders here under encounters, and we would be able to access them that way. As a reminder, we can maximize this screen if we wanted to see the full list of what was available, and then minimize it to go back to our face sheet. For those of you, again, that haven't been part of our workflow prior to today, we've gone over our workflow with the medical assistant for our reason for visit. That's going to give us our HPI, our vitals, our history, and our review of systems. And so that takes us to our physical exam. In that process, we're expecting that as the medical assistant completes that process of the first 4 items under our contact subheading, that after that, they would pass the chart to you. This button here in the top left, this green forward arrow, is like handing that chart from one person to another person. And so we, in order for that to be, when the medical assistant was completed with their piece of it, they would click this button and it would send over to you. You would identify that if we toggle over to our desktop view. This is what we see when we first log in. Here on the desktop view, your appointments will be listed on this sheet here. And here under your your tracking status / room is going to identify that it's ready for provider. And when it's ready for provider, that means that your medical assistant has completed their piece of it, and then they've passed that chart on to you by using this green forward arrow. You would be able to double click on that, and then it would launch you here into the patient's face sheet. A nuance of Allscripts is that we could only have one person in documenting in the chart at a time. That's like if we had a paper chart and we passed it on from one person to another, one person can write in that chart at a time versus having more than one person writing in that physical chart. The same is true for Allscripts here for any information that is below this contact button here. So if your medical assistant is actively typing and entering information in and you try to go into the chart, you would receive a notification that would pop up saying that someone else is in the chart and that it's locked. If there's somebody in the chart and inactively in the chart, meaning that they're not populating any information, not typing, not clicking away in their HPI or their review of systems, in this contact piece, then it will give you the option to take it over. And at that point, you would be able to take over the encounter, but then it would prevent your medical assistant from typing anything in. We do save as we go in the system, and so anything that has been entered will be saved as someone is typing it. However, it will prevent any additional information from being saved as someone enters that. So be conscientious of that when you're working on your workflow with your clinical staff. Have communications about how you're going to work around that. I know that's new for a lot of us. It is an enhancement that we have requested Allscripts to look into. However, that is not the way that the system works right now. So we'll need to work around that in the meantime. So here in physical exam, we're going to click on the physical exam under our contact here. And our vitals are going to pre-populate onto our PE. You'll see here that at the top we have our templates, and then it will list templates here. If we click on that, it will drop down our templates that are available. We can also use the arrow for that to see the same thing. We've never entered any information on this patient before, so I do want to show you what it would look like if we file this chart and we pull a patient with me. If we pull a patient that we have seen before, and if we go into that same physical exam, you'll see that this is that notification that I was telling you about. This encounter is currently in use by system manager. Do you want to take over the encounter? And that means that they're not actively putting anything in, and I can say yes, but now it's going to prevent them from adding any additional information. Under the templates, because we have recorded things under this patient before, if we use that drop-down arrow, we'll see that the last 3 encounter templates are available here to view. And so if we go back to our test patient, click on that search training patient so that it comes up. We'll go back into our encounter, go back into our physical exam. And again, you'll see we haven't seen any patients, so we don't have anything listed under encounters, but that would be a great way to reference the encounter physical exam templates that we have used previously that we could carry forward if this patient was a recheck. So the templates that we have listed here, we have orthopedic templates, we have 2 pain management templates, and we have podiatry templates that are listed here. These templates are out of the box Allscripts templates. They are not OCC templates, and we should recognize that these were not created by providers, but they were created by software engineers. And so while they're a great foundation, this is not ultimately what we will want to use in our templates. Again, it's a great starting point. And as we get into more of the how-tos of building a template tomorrow, this will be a great foundation to work from. Our expectation is that our EHR committee members have all taken an anatomy and that they are building templates that we could use out of the box by body part. And to get to those, if we use our little, our visit templates box, but it looks like a clipboard with a lightning bolt on it. If we click that, you'll see that anyone who has saved templates is listed in the top left here. Dr. Jacobson is one of our EHR committee members, and he has been assigned to create our foot and ankle templates. And so you can see here that he's completed them, he saved them under left and right, and those are available for us to use. When we are ready to go live and we have the information published from the rest of our EHR users, up here at the very top, under System Manager, you'll find that each body part is listed individually. So we'll have hand, fingers, wrist, elbow, shoulder. We'll have spine and lower extremity, hip, knee, foot, and ankle. We'll have those subfolders there that you'll be able to double click on. You'll be able to choose one of these templates that we have pre-created for you. You can choose it by diagnosis. You could double click on it and you could apply it to your visit. If you liked it, you could use it directly out of that folder. If there are some things that you want to change to it, you could make those changes and then you could save it as your own template once you signed off on it. We're going to get more into how we could make those changes tomorrow, but wanted to take a look at what these look like today. So if we were to decide that we wanted to use this Achilles rupture right template that Dr. Jacobson has already created for us, you'll see here that anything grayed came from our patient intake process. So we got this all from our patient intake that our medical team is going to do for us before it's passed along. And then if we scroll down, we'll see that here is the physical exam. Right here, it's attached to the diagnosis that's been listed as well. We could choose to move this forward if we want to. We'll go into how to move some of it forward and not move some of it forward in future trainings. But for right now, we're going to take our physical exam, and then to apply it to our encounter for today, we're going to click OK. It then takes us to our history and physical screen. Whether it makes sense to us or not, the history and physical screen is what is considered our chart note. Again, not that it makes sense to us in our workflow, but that's what it is defaulted as. When we drop our physical exam in here, all we need to do really is go into our physical exam here under our contact sheet so that we can see what it looks like in our system. As we talked about yesterday, anything that we hover over and turns blue, or that gives us a pointing hand, has a hyperlink attached to it. And so we could use it and drill down more as if we wanted to see more information, get more specific. To get back to our home screen of physical exam so that we can see everything, we just click this home button here. And then again, we can see everything. We could make changes one at a time, but we're going to go over that tomorrow. So tune in tomorrow to see how we could make changes to that. Another option that we want to go over is an alternative option for those who just don't want to do the clicks in our staged templates. And that option we're going to go through by offering a voice recognition option as well as a memorized phrase option. In order to do that, we are going to remove our physical exam template from this patient. If we wanted to do something, if we wanted to remove a component of it but not remove the whole thing, we could certainly do that, much like we went over yesterday in our training. If it's highlighted, if it's bolded in our text, that means that we have information that has been populated. We could click on that one sub-item under our physical exam, and we could use our clear selection trash can here, and we can choose to clear it if we wanted to. If we did that, you'll see that down here in our viewing screen that the peripheral vascular system has been removed from here, and so that we no longer have that information. If we wanted to remove the whole thing, we would go up here to physical exam, make sure that that was highlighted. We would choose our clear selection trash can and remove it. You'll notice that our vitals still remain, and we want to make sure that we have that because that is a MIPS criteria that we report. So that pulls forward automatically. So for those of us who don't want to use the clicks and we don't want to use the templates, we do have an option, like I said. We're going to go over two ways of doing that. In order to get to those selections, we're going to go to our physical exam, and we're going to use our pencil directly to the right of that. And our notes screen is going to populate. Here, we could dictate and put our dragon cursor here and dictate. We can put all the information that we want here. Those of us who want to stick with our SOAP note, this is where we would record our physical exam portion of that. And then if we click OK, you'll see that that information will drop down and be put into our note. If we click that hyperlink, it will launch our physical exam note screen again. We could make any edits that we wanted to, and then we would click OK, and then we could, and it would update for us. Another option, again, I'm going to take that physical exam, and I'm going to clear that selection by clicking the trash can, hit yes, and then it disappears. Another option is going through this same process, but we could use our memorized phrases or auto replace text by clicking our pencil. And then we're going to use our auto replace button here. If we use our drop down arrow to the right of our A to A icon, as a reminder, all of our auto replace library will be listed at every time we see that icon. And so it's really important that we put some kind of identifier to let us know what we're using it for. You can see that we have some already built in. Some of them have been identified as AP, which we would be able to identify as assessment and plan. And then we have some PE, which are our physical exam. And then I have a PT standing order as well. So although we're in our physical exam template, my whole library is going to show here. In order to, if there's something here that I want to add, I could go to Add Auto Replace. It will launch here. I would name it our PE underscore, and then my item that I want it to be. There's not a space bar here, so I recommend that you use underscores and capitalization to be able to identify words. You could then put information here, and you would click OK. And then next time when you come here, you would see that it's listed under our library that we built. And if you click on it, it will automatically populate the information. Another great resource that we have is that if we go to our A to A icon versus our arrow, if we click our A to A, it will give us the option to copy other verbiage that has been done by other providers or other users for our whole library and all of OCC. The library that we see when we click our arrow is specific to our user. That's individual to us. However, if we go to our A to A and then we go to copy, we can copy forward other information from other users so that we can use what's already been created. We are building some memorized phrases that could be used in assessment and plan, specifically to our consent, our in-office consent, risks and benefits, those kind of things that we'll go over when we go through our assessment and plan. But you'll see that there's a large library here that you could choose from. If I wanted to carry that forward, I could double click on it. And then I would see that my EMG nerve conduction study will then be part of my library if I go to my drop-down menu. For today's visit, if I go to my physical exam and I drop in my physical exam wrist, you'll see that I've built out a physical exam. This would allow us to edit our physical exam just like a Word document. We could go through and make any changes necessary. And then we would click OK, and then it would drop into our physical exam. It is a hyperlink, so if I click on it, it will launch the whole physical exam note that I could edit. And the functionality that we do lose by using it in this way is that it is a single hyperlink that we can't drill down to just the alert status or just the range of motion status. It would be the whole note that launches. You'll see here under our note that everything is well aligned and put in paragraph form. It looks really nice in here, and it would be easy to identify this information in a note. When we click OK and it comes into our physical exam template, it is just a really run-on long paragraph here. When we go to our note, it does take the format that we have in our notes section, so it's much more legible that way. So something to think through when you're trying to decide which one is a better fit for you, of whether you're clicking or whether you're going to build out your templates. So we are going to talk through how to build out our templates tomorrow. I recommend that between now and then that you get into the system and you do a little digging. Look at the information that's already been created. If you have good memorized phrases in your current EHR system, I recommend that you copy those and put those into a document. So you can start copying and pasting those into our memorized phrases like we went through today. You could build that not only for your physical exams, but for your other functionalities as well, if you wanted to add your assessment and plan memorized phrases as well. The other thing to do before tomorrow is take a look here at our pre-built out-of-the-box Allscripts templates and see what those look like. You'll see, I'm going to clear this one. And if we go to our template, we take our shoulder and we apply it, it will apply our shoulder template. If we're seeing the patient for more than one thing, we can, with this application of our shoulder template, we can also click our down arrow. We could go to our wrist template and apply as well. When we apply that, we're going to get a message that says, do you want to combine these two? Do you want to replace your template one with another? So it would remove our shoulder template, but apply our wrist template, or skip saying, whoops, I didn't really mean to do that. And because we're seeing the patient for more than one injury, we're going to say combine. It's going to say that it's going to combine these items, these categories here for systems, and we hit combine, combine, and then it will do that for us. You'll see as we scroll down that we now have our shoulder template piece in. We also have our wrist physical exam in as well under our musculoskeletal system, upper extremity. So we do have one question. The question is, if a provider does not want to use any clicks and prefers to use the A-to-A or Dragon and SOAP format, will the E&M coding function in PM still work? Good question. The answer is we are going to choose our E&M coding manually based on the interactions that I've had with our billing managers and our practice managers, as well as our physicians, that most of those that are, most of the systems that will give you and assign an E&M service for you, E&M level for you, most of the time we are overriding that anyway. So when we do our sign off on the chart training, we'll be able to go over how to do that. But you'll be able to choose the appropriate level according to your physical exam and assessment and plan, regardless of whether you use our Dragon, whether you SOAP note, whether you use a memorized phrase, or whether you use a template system. Another question is, if you have a chart pulled, can you be logged in at more than one location and still have it in your possession? Or is the chart pull tied to the active workstation? The answer to that is that you can be logged into more than one computer at the same time, and you could be looking at different charts. If you were going from one computer to another, you would want to go up to your name. You would log out. It would take you back to that green screen. You would go into your next computer, and then you would log in, and then it would launch you to that same patient chart. Another question that we have is, where do we include imaging interpretation? Great question. That's going to be in our assessment and plan workflow that we are going to talk about either starting on Friday, depending on how far along we get in our build tomorrow, or on Monday. So stay tuned for that. That does conclude our time that we have for today. I will stay on the chat to answer more questions for the next 10 minutes. So feel free to engage and ask questions there. In the meantime, don't forget to come and look at the templates that have been built already, so you can be familiar with that tomorrow. And we'll meet again tomorrow at 8 and 3 for part 2 of our physical exam training session. Thank you guys for your time this afternoon, and we will see you tomorrow.